Now, on the flip side, so we've already mentioned a few of the features about Nocardia, right? But probably one of the most important is that it's partially acid-fast, okay? Remember what I said about that. I said acid-fast is going to be a really important feature because if you see something in a question that is mentioned as acid-fast or partially acid-fast, you should already have kind of a short list in your head of what the potential organisms might be, okay? Now, the different species that cause infection in the genus Nocardia are Nocardia asteroides and Nocardia brasiliensis. So those are probably the most clinically important species. Again, we mentioned that these were aerobic, okay, and partially acid-fast, and the reservoir is basically soil and dust. So transmission is exogenous. And predominantly, when we're talking about the Nocardia and exogenous transmission, talking about airborne transmission, but you can also get this from traumatic implantation. Now, the diseases for Nocardia, you can have cavitary bronchopulmonary nocardiosis, and if you look at the symptoms and you read those, you have cough, fever, dyspnea, diffuse pneumonia with cavitation, okay? Now, that can look very similar to TB. And in fact, Nocardia usually shows up in immune-compromised patients. And Nocardia is partially acid-fast. Tuberculosis is acid-fast. So you definitely want to be careful, again, when you're reading those types of questions. Now, if they mention partial acid-fast, it's a big clue for Nocardia. The other big clue is if they say acid-fast branching rod, because tuberculosis, again, is not a branching rod. This can access the CNS, so it can spread to the brain, again, but you have multiple foci. Whereas in, again, actinomyces, you typically have a single abscess formation when it reaches the CNS. Now, traumatic implantation, you are going to step on something, you're going to get scratched with something, it's going to implant the organism into the tissue, it's going to start draining, and you have a draining abscess very similar to what we showed with actinomyces. You will also, in that particular case, have the sulfur granule formation, okay? So that can be diagnostic as well in a case of subcutaneous nocardiosis. Diagnosis, we could do culture, gram stain of the sputum, and treatment, we're going to use sulfonamides or trimethoprim sulfamethoxazole. Now, here's again where they can easily ask you a vignette. You've got an immune-compromised patient with these respiratory symptoms. They tell you that you have partially acid-fast rods or branching rods, and then they're going to want to know how you want to treat that patient. And what they're going to do is they're going to list sulfonamides or list TMP, SMX. They're also going to list all the TB drugs. And boy, when you see a list of lots of tuberculosis drugs and then sulfonamides looks like the outlier, okay? And you're going to be scrutinizing those TB drugs. Well, if you picked up the clue about partially acid-fast or branching rod, you'll know then that the treatment is sulfonamide. So again, that's another thing you might watch out for.